To talk more on the prostate cancer challenges facing South Africans, we have invited Professor Michael Herbst, a health specialist from the Cancer Association of South Africa, Cancer. Michael, Prof, thank you so much for joining us. This is, when you just joined me in studio, you said this is a very sad day, and it is a very sad day. Hugh Masekela, an amazing musician.
What a master that has departed. And may I express my personal condolences to all his family and all his loved ones. May he rest in peace.
Definitely. Now, Prof, let's speak about this prostate cancer. It's a major problem in South Africa. It's the number one cancer amongst men, and it takes so many people away with it. What exactly happens? I heard somewhere where they basically say that there are no symptoms. There are no.
Very often there aren't any symptoms, and we don't know the exact cause. Apart from that, the Afrikaans people calls it the old man's gland, because it was really a problem more of older men. But we're seeing it happening and occurring now in much younger men, even from age 40.
Why is that the case?
Well, we don't know the exact cause, but it's most probably the environment, the chemicals and things that we are exposed to, that we're taking in, and it really affects men very badly, because in the middle through the prostate gland, there's a little pipe that comes from the bladder that allows urine to pass through to the outside. And as the gland, because of the problems within the gland, it swells and it closes off eventually. And men with prostate cancer, they find it eventually quite difficult. The stream disappears, the strength of the stream disappears, and they have difficulty sometimes in passing urine. But it needn't come with many other problems like severe pain or something that one would expect.
So basically this is a silent killer.
It is one of the silent killers, except that we do see the signs when somebody complains that they've got difficulty in passing urine. The stream isn't as strong as it used to be.
Now, Prof, let's speak about a recent study that suggests that high levels of animal fat ingestion are associated with a higher risk of prostate cancer. What's your view on this?
That is definitely so, and we especially link this to more of the red meats. That is really a problem, and red meat is not only linked to that, it's also linked to colorectal cancer. So it is really a problem that one should try and limit the intake of red meat. But I know us South Africans, black and white, this is our staple diet apart from pop.
Yeah.
This meat is it.
Cutting down on meat, red meat more especially.
It's not easy.
How should men get it right? You've mentioned the fact that prostate cancer is now starting to occur earlier. It's not an old man's disease anymore. How do we get men to understand what prostate cancer is and how to try and ensure that they don't get it? How do they deal with that?
Can I speak on behalf of men?
Yes.
We are very bad at health-seeking behavior. We are the hunters. We are supposed to be the strong ones. And if I go to the doctor too often, I'm admitting that I'm not as strong as I want to pretend to be. Guys, we don't only owe it to ourselves to look after our health. We owe it to a spouse, a brother, a sister, a mother, a father, a child, whoever it may be that wants you around and appreciates you being around them. We owe it to them to remain healthy. So what do? We must, especially if there's prostate cancer in the family, from age 40, 45, and definitely not a day later than 50. Go to the doctor every year for a prostate-specific antigen blood test, as well as a digital rectal exam. And this is what scares the men. is the digital rectal exam.
Explain that, just simplify it so that men are able to understand. What happens is
the doctor puts on a glove on his finger, and he lubricates the glove, and he puts the finger into the rectum to feel the prostate gland, whether it's irregular, whether it's swollen, and the two together, they must go together. The digital rectal exam together with a PSA test. And then, if diagnosed early,
I was just going to
we
say,
can save so many lives.
In terms of the early diagnosis and the treatment, what sort of treatment does it entail? Is it like the normal, the other cancers, for instance, breast cancer and cervical cancer, for instance, in terms of the treatment? What regime does a man have to go through to deal with the fight against prostate cancer?
Again, everybody is an individual, and depending on what one's age is and at what stage the cancer is diagnosed, it can be surgery, it can be chemotherapy, it can be radiation therapy, or a combination of these. It could be a hormone therapy where we remove the testosterone from the bloodstream, because a lot of the prostate cancers, they thrive on testosterone, the male hormone. So the person is given medicine to suppress the secretion of that. Very often they even remove the testicles of the man so that he will not produce any testosterone in his body. But it saves a life.
Is the Cancer Association, do you think enough is being done to create awareness, to get men on board with regards to prostate cancer? There have been other high-profile patients or people who have dealt and gone through prostate cancer and have gone into remission, and some are still dealing with the therapy of recovery in terms of prostate cancer. Is enough being done to create awareness and ensuring that men know about prostate cancer, and they do, as you mentioned, the annual tests and annual doctor's appointments to make sure that, and diets, changing their diet? Is enough being done?
I don't believe that enough is done. It can never be enough education as far as this is concerned. The Cancer Association of South Africa is very proud of the work that we are doing. And I think it would be wonderful for your viewers to appreciate that in March we're going to have the Daredevil Run again. And that is Hollard in collaboration with the Cancer Association of South Africa. And men will be running through the streets of Pretoria, Johannesburg, Durban, and a few other towns in their purple Speedos in support of prostate and testicular cancer. And when they see these gentlemen run, please remember that could be your father, your uncle, your brother. And let's support them. And it takes courage to run through the streets in only a Speedo. And we really so honor the men who go that far. But we've got to do more than that. We have to go for the annual tests, and then we can say, yes, personally I am doing something to preserve my health and to stay as healthy as I possibly can.
Prof, what other, in terms of programs, what other programs is the Cancer Association running with or busy with to create awareness of prostate cancer?
Every November is sort of Men's Health Month. Then we focus specifically on the cancers more prominent amongst men. Like during October we celebrate women and we concentrate on breast and cervical cancer. So November is the month where we concentrate on that. But we don't neglect it during the rest of the year, because we have other cancers that we have campaigns for. Like September again is childhood cancers. But we've got to always do this continually throughout the year, even though we have special campaigns scheduled for particular months. But we must think of this every day. And women play a major role in supporting their boyfriends, their spouses, their husbands or whoever. And women can play such a major role in convincing them, please, my dear, it's time for you to go for your annual checkup.
Prof, with regards to the success rate of patients or men going into remission and overcoming prostate cancer, just take us through that, and what sort of numbers or figures are we looking at? Are you able to give us that information?
Unfortunately, we know how many people have been diagnosed with cancer, but we sort of tend to lose track of them then. We're not very good at keeping that type of statistics, but I can tell you what you said is so true. There are so many men who have become survivors, and everybody can do it, but the earlier the diagnosis is made, the better the outcome. We can't wait until you have a total blockage, the cancer has spread to the lungs or to the brain or to the liver, and then expect a miracle to happen and to come out at the end to go into remission.
Prof, very quickly, just as we wrap up, with regards to the Cancer Association and the work that you do, which is, as you mentioned, it's a lot of intense work and going out there and sort of putting yourselves out there. If you look at the urban areas and rural areas, in comparison,
you know, if we talk about people living in the rural and far rural areas, it breaks my heart because of a lack of access. And you know, thinking of people in the rural areas, because there's so many black brothers living in the rural areas that don't have access. And research has shown that black men very often get a far more aggressive type of prostate cancer.
And why is that the case?
We're not exactly sure. It was picked up first amongst the Afro-Americans and not with the white Americans. And they then started tracing it back to Africa, because that's where our brothers from the Afro-Americans come from. And it is now being proven day after day that the incidence is high and very often a far more aggressive type of prostate cancer. So my brothers out there, my message to them is, please look after yourself. Don't be afraid. Go for your annual PSA test and the digital rectal exam. Think of the women folk who go willingly every year and they go for a pap smear, they go for a mammogram. Why can't we also once a year go and have our tests done? So that we can remain healthy for the loved ones who depend on us.
Very quickly, Prof, where do people get more information with regards to, not only prostate cancer, of course, there's
any of the over 200 cancers that we have.
Where do they get more information? Those that have
access to the internet, they can go to Cancer's website, www.cancer.org.za. If they need to talk to somebody or to get specific information, 0800 22 6622, and it's a toll-free line.
Prof, thank you so much for joining us.
Thank you so much for having me, and really that we had to have this talk because of the sad loss for the whole nation.
Actually, globally.
Well, internationally, you are so right. And my heart goes out again to all his loved ones, and again, may he rest in peace.
Professor Michael Herbst, thank you so much for joining us.